I move to propose the continuation into force of the Health Amendment Act 2021 to the 30th of July of 2021. To remind the House, this Act provides for the mandatory quarantine in designated facilities of persons coming into the state from certain areas, commonly referred to as mandatory hotel quarantine. It has been operational since the 26th of March 2021. It's been an important part of the public health measures to combat the transmission of COVID-19 and in particular variants of concern. The Act contains a sunset clause in Section 9 and, unless extended by a resolution passed by each House of the Oireachtas prior to the 7th of June 2021, it will expire on that date. Notwithstanding this, subject to the passing of the proposed resolutions by each House, it's important to note that the Act does provide for further extensions of up to 3 months. Any further proposed extensions would be informed by the public health situation in July. The Act requires travellers who, in the 14 days prior to their arrival in Ireland, have been in or transited through one or more designated states to undergo a 14-day mandatory quarantine in a designated facility. This requirement is subject to a number of exemptions and can be reduced if a negative COVID test is taken on or after day 10. The Act also requires those travellers without a negative PCR taken no more than 72 hours before arrival to enter mandatory hotel quarantine until they return a negative test, and these tests are turned around very quickly by the HSE. My department has led on the implementation of mandatory hotel quarantine, supported by several departments, including Defence, Foreign Affairs, Justice and Children, Foreign Affairs, Transport, Justice and Children, Equality, Disability, Integration and Youth. Also involved were the Defence Forces, An Garda Síochána, the Border Management Unit, the Garda National Immigration Bureau, Revenue, Customs and the HSE. A single service provider is providing full board accommodation to guests in facilities designated exclusively for the purpose of quarantine, as well as ground transportation, security services and health and wellbeing services for guests within their facilities. The provisions of the Act allow travellers to request a review of decisions relating to their quarantine. However, this can only be undertaken once quarantine has begun and on a limited number of grounds. The Department of Justice is supporting my department in relation to the review process, which provides a 7-day-a-week service. Decisions must be returned within 24 hours of receipt of the request for review. Requests for review are based on the specific grounds established in law. Appeals officers have been selected from a group of barristers who are also providing a service in relation to the International Protection Appeals Tribunal. As of the 26th of May, there have been a total of 1,563 appeals. Of these, 175, or 11%, have been granted and 1,388 have been refused. Medical services are available on-site 24/7, and it is also possible for a person to leave quarantine in case of a medical emergency and to attend urgent medical appointments. Special arrangements have been made to allow those seeking international protection or unaccompanied minors to undertake their quarantine in alternative appropriate circumstances. A procedure is in place within the Department of Foreign Affairs missions for deferral of repayment or prepayment for Irish citizens and residents abroad in hardship circumstances. A procedure is also in place for Erasmus students who should contact the Erasmus office in their third-level institutes, who will then make the booking on their behalf. This standard cost associated with mandatory hotel quarantine is covered by the Department of Higher and Further Education, Innovation and Science. As of the 27th of May, a total of 4,616 people have entered mandatory hotel quarantine. Of these, 178 residents tested positive for COVID-19. According to the latest available HSE data, 59 variants of concern, or rather 59 cases associated with variants of concern, have been detected. We're awaiting the results of whole genome sequencing on some additional samples at this time. This data does not take account of cases which have been avoided in the community as a result of mandatory hotel quarantine. While home quarantine could be effective as a measure for lower risk travellers, there are significant practical and legal challenges in monitoring and enforcing home quarantine for higher risk travellers. The high level of people with asymptomatic infection remains a challenge. This creates the risk that new variants could be imported and would not be identified during the testing process in the absence of mandatory hotel quarantine. Also, many countries have been unable to adequately monitor new variants, which adds to the risk of circulation. While we have recently seen encouraging research which indicates that the vaccines we are using are effective against emerging variants, we need to remain vigilant. Some 2.7 million vaccines have been administered to date. That means that over half the adult population has now received their first dose. Despite this positive progress, we must obviously remain vigilant. As the Taoiseach announced on Friday, from the 19th of July, Ireland will operate the EU Digital COVID Certificate, or DCC, for travel originating within the EU or European Economic Area. Also from that date, Ireland will broadly align itself to the EU approach to non-essential travel from third countries. This proposed extension does not preclude adaptation of the operation of mandatory hotel quarantine in response to the introduction of the Digital COVID Certificate. The legislation permits the designation of states and revocation of such designations and the creation of further categories of exempted traveller. As I mention this, I am pleased to share with the House that we recently revoked the designation status of Belgium, France, Luxembourg and the United States. In light of the risk associated with variants of concern, it is essential that cases arriving in Ireland are detected and traced as effectively as possible. In this regard, it's important to recall that many cases, 30 to 40%, are asymptomatic. Without mandatory hotel quarantine, it's likely that certain persons infected with new variants may arrive and not subsequently present for testing due to a lack of symptoms. I'd like to re-emphasise that mandatory hotel quarantining has worked and is working very, very effectively. It's been effective in supporting the public health measures to combat transmission of COVID-19 in our country, and particularly as that relates to the variants of concern. It has contributed to the reduction in case numbers and the creation of space in which the vaccination programme can be rolled out. In turn, this is supporting the continued reopening of our economy and our society, and it is also playing a very important role in supporting our safe return to international travel. Garmagwith.